everyone. We are here again
Here we
talk about things that we have to deal with day in and day out that are just wrong. And part of what we're trying to do is educate you in order to help yourselves on the right way of doing things. And today we're talking about filler, which has become one of our subjects that we are the most annoyed by, because we have people who come in and first of all, they don't know what they need, but they have decided, oh, I need this done, I need that done for their lips, whatever, with filler. And they also come in and they've seen other people who do not evaluate them and look and see anatomically what do you really need versus what you think you need.
Exactly.
And so let's talk about some of the things, some of the problems that we deal with when we have to fix people and how we evaluate. Let's talk first and foremost about how we properly evaluate people for filler, and when is filler appropriate, when is filler not appropriate. So let's start, because you always have incredible insight on that. So let's go with that first.
Yeah, I mean, I think the main thing is that filler, it's not a one size fits all. You know what I mean? I don't care if it's your sister, your mother, whomever, everybody is different. Your eyes are basically going to be the widest part, your cheeks and your eyes. You've got a triangular approach to when you're correcting or trying to enhance somebody's appearance. So we don't want to start building up in increasing volume in the lower face and the mouth or whatnot, and then all of a sudden have this getting larger and shrinking down what looks like the eye area, giving more of a pear appearance. Some people will end up with that. So by taking a moment just to take a look at them and look at their eyes, look at the size of their eyes, look at the symmetry of their eyes, their mouth, and so forth, and try to determine how best to put this filler and where, that is going to be important. Some people may think they actually need it in the lips, when in fact it may not be the lips at all, but it may be the sides of the mouth, or for that matter, it could actually even be a bit in the cheeks that's dragging things down and giving the mouth a more thin appearance, but it's not the mouth at all.
Well, so one of the things that we constantly have to deal with is, look, there are a lot of places that you go into and they've got 5 minutes for you, okay? And in that 5 minutes, if you say, I want filler in my lips, presto, you get filler in your lips, a little glob that's here, a little glob that's there, a little glob, a little glob. And they don't think about symmetry. Number one is this about when you put filler or when you assess anybody for anything, you need to go to someone who has an aesthetic eye.
Exactly. Who
individualizes you, who looks at you, who has a moment. I mean, we take an hour or so, me longer, when we inject people, because number one, you need to look at people, you need to talk to them for a minute and see how they animate.
Exactly. Animation is huge. There is no question about it. You cannot do one type of filler on every person and have it look proper. It's just not going to.
And then part of that is, we watch you when we're talking to you. We're talking to you, we're interested, but we're watching you and we're assessing, are these cheeks melting? What they found is that your cheeks the bones are melting as you go down the path of life. But yet we see people who come in who've had huge wads of filler put in the front of their cheeks when in fact they needed it in the side, in the temples that are thinning, and if you have it put here, you look like a chipmunk storing your nuts.
Sadly, and I've heard this many times, and I know you have too, the only filler you notice is the bad filler.
Correct.
So right off the bat, there are days where I have seen patients, and I know you have too, and it's hard for me to focus on their eyes because my face wants to go to what looks like a golf ball that's been cut in half and just put right here. You can see where it looks like an implant, where it begins and where it ends, and when they animate, it does some of the craziest things. That's not the way filler should be.
Well, and you should never, my aesthetic, our aesthetic is, you can have lots done, but you should never be caught looking like you had anything done. You never want people to see that you've had filler. Look, lips. You can do beautiful lips that belong on your face, but they don't enter the room before you do.
Exactly.
And they don't look anatomical. People aren't born with lips like some people have. And we have names for that, but we're not going to do that, say that on the video. But the other thing is, I increasingly, because people lose in long, thin faces,
Right.
I will often put a little filler at the angle of the jaw.
Absolutely.
Just to widen the face a little bit when the face is getting too long and narrow.
And exactly, and it helps to just kind of bring it back. It lifts up this jawline. It helps with what are called the marionette areas of the face. And it's just enough to give you a little boost in this region. And you know, that's that's kind of a little trick, so to speak, of some people that you see that are aging but look amazing. When you look at people in the public eye or people in the acting business or whatever, small little amounts here or there can do just enough to
And it
raise
also
that.
helps pull up your neck a little
exactly.
bit. I mean, the alternative to that is threads, but even with threads, and this is the thing about filler and why we're talking about this, is because filler is imperative as we go down the path of life. In men and in women, men have thicker skin so they don't use it as much, but our bones are thinning. It's not just your skin thinning. Your skin is thinning, and you lose the fat, the volume, because you've lost your hormones that keep the fat all plump there.
Everything.
But your bones are thinning, your teeth are thinning. Sometimes we see people as we're doing their mouths that are asymmetrical, and you can feel a tooth here, but they don't have a tooth that protrudes as much here. We have to assess that when we do your lips.
Exactly. It's not just go in and fill it. There is so much that goes on with this. One other thing that I think is important too, we were discussing this earlier because we have seen some filler that's not so great. Women especially use a lot of lip liner. When it's lumpy and bumpy, it's virtually impossible to put a lip liner on because you're getting these bumps. You need to make sure that this is not happening. Sure, you're going to get a little bump here or there maybe, and right after it's done, it's going to feel a little asymmetrical. But the thing is that's not normal. And right now, we honestly come to the consensus that many people probably don't know what it feels like to have normal filler put in because it's been done so poorly that there's a lump here, a lump here, a lump here, and then maybe one here, and then maybe one inside the mouth over here. And they just assume that's the norm when that's not the norm.
No, it should be smooth, and that's because you've got to take the time, and you have to see. Look, we're all very asymmetrical, and we become more asymmetrical as we go down the path of life. And so that asymmetry, you've got to try to correct within the best of our human ability, human hand ability.
The other thing too that is another telltale sign, which I cringe at when I see, is somebody that's aging in many respects, beautifully aging, but still could use some radio frequency skin tightening or this or that. And they've got a lot of wrinkling around this perioral area, but they've got these huge, voluminous, tight, big lips that do not match the rest of their face. It's just not realistic. I mean, I'm lost for words, honestly, when I see that, because it's just, there's so much going on, but it just doesn't look right.
And the other thing we need to talk about is two things. Number one is the type of fillers we use, but also there's a huge amount out. We are very loath. We do not like to do, we practically won't do filler underneath the eyes. Because what they found, explain what they found.
I mean, there's a few different areas that go into this region. You have what's called the tear trough, you have a pseudo tear trough, you have an upper cheek and so forth. But when people are looking tired or feeling like they've got this dark hollowing going on right up in here, and these can be people that are young even. These are not older people necessarily. These are 20-year-olds, males and females. And they think that the filler is going to do the job. you better make sure that wherever you go, they know what they're doing. And if they feel that this is not the right treatment for them, they don't do it or perform it or whatever. Because it has been found that filler can actually get behind what's called the orbital septum, which is behind
The
this
eyeball,
bony
in other
structure.
words.
And some research studies have shown that it has been there for 12 years. So when
And it swells up and it looks, you do not want to be caught looking like you've had something done, especially for years.
Exactly. Exactly. When you're going to have this change, I mean, think of 12 years with filler. Think of how much you change in 12 years. Nobody wants to be married to a product in their face that long. You change every single year. You do not want that product.
And you don't want that swelling
sitting
underneath there. And it's very difficult to dissolve that.
Pretty
Virtually
much
impossible.
virtually impossible is
Yeah.
right. And if you can find somebody who is savvy enough in removal of that behind the orbital septum, it's a major
They have
procedure.
to do it like under ultrasound or MRI guidance.
Yes, exactly.
So you must be very careful about this. What's the alternative? CO2 injected underneath your radio frequency, Indymed, microneedling, Morpheus, Indymed, all those things can lift and tighten. And also internally, your adrenals, I mean, there's all the internal things, basically.
And, I'm sorry to interrupt, but I just want to throw in too, another thing that needs to be taken into account is lymph. Some people think that they just need to get filler because they've got this trough formation or this bagginess here. It's not fat, it's not a bag, it's lymph formation. And why are they congested in that area? That's a whole other conversation. But it's not that filler is going to even help them because it's not.
Can make it worse.
It can make it worse than make it better. These are all the important things.
And then the other thing that we need to talk about is we do not use Sculptra or Radiesse. And here's why.
Sculptra and Radiesse are out there everywhere in the world. People are using them all over, and they're using them in all kinds of different places. Sadly, I've heard of Radiesse being used in the lips as well.
In the butt.
In the butt, the jawline, the hands, the tear troughs, you name it. Radiesse is what's called calcium hydroxyapatite, which is basically crushed up calcium. Calcium is rock, it's mineral. It's used in femur or bone remodeling.
Sculptra.
Sculptra is another one. Sculptra is made up of crushed up like suture material.
No,
basically.
Radiesse is crushed up suture material. Sculptra is the calcium hydroxyapatite.
Opposite.
Yeah, it's the opposite.
That's okay. That's okay. You got it.
I don't use it.
She doesn't
Never
use
used it.
You know, you're exactly right though. The only reason I remember that though seriously, because I don't use it either, is that Radiesse, it's white and it's that crushed up rock, and they have a brochure where they show hands. Who wants to put crushed up rock filler in the backs of your hands to give you a youthful appearance when it's going to show through the skin and everything else?
It makes them all swollen.
It's white.
And it's there forever.
You
can have an allergic reaction to Sculptra in particular and get little nodules, granulomas, and you can virtually never get rid of them. Everybody tries with hydrocortisone, steroids, etc. Can't get rid of them. But the point is, you do not want to put a foreign body.
No.
Inject that. Hyaluronic, fine and dandy, Juvederm, etc. We morally and ethically don't use the Galderma products.
You know, Galderma is part of the Nestle Corporation. Nestle Corporation has a lot of issues when it comes to the rainforest, baby formula being sent over to India, lead contents in rice formulas, and they're in the filler business now too.
So we morally and ethically only use the hyaluronics. Number one, morally and ethically, that company Allergan that we use, but also not the permanent fillers.
Exactly.
That if anything's wrong, you're stuck with it forever.
It doesn't come out. Hyaluronic acids, we have what's called hyaluronidase, which basically can melt the hyaluronic acid down and do whatever. The problem with the calcium hydroxyapatite, the Radiesse, or the Sculptra, you can't get rid of them. Once they're there, they're there.
It's
So
scarred. It's foreign bodies that are put in there, and
that brings up a good point too with foreign bodies, because anybody who may have a condition that's autoimmune related or even not know they have one, this could be something that could truly trigger that unknowingly, and then have that happen and not ever really quite understand why. It's a foreign body that their body is having to address.
and you don't want to remodel your God-given anatomical structure. You want to enhance it. You don't want somebody whose aesthetic eye you're not sure about to put something in there that's permanent, in our opinion. Medicine is an art as well as a science, but our job is to educate you about why this versus that. And happy to inject a hyaluronic in there that your body normally produces, but
Right.
just doesn't produce as energetically or as to keep up as you go down the path of life. But to inject something in there that doesn't belong in there is not, in our opinion, a do no harm
Exactly.
way of doing it.
It's a risk that you're taking. Not only that, but again, as we had mentioned, you're aging every year. So why do you want to keep a filler maybe that was put up here, and all of a sudden we're aging, and let's say it's down here now. If you can't remove it, or like hyaluronic goes away, you can adjust for age. With these, they're there. I think,
and that's a good point. Look, as we go, if you have a bunch of filler that's put in here,
Yep.
normally your body consumes it.
right.
But these cheek pads start to fall because they're surrounded by collagen. The collagen starts to get loose, which is why skin products and the things that we do that
Right.
lift and tighten and help make new collagen on a daily basis. But if everything starts to fall, people sometimes talk about filler traveling.
Yes.
And part of that is not that the filler travels,
Nope.
it's where the collagen and the fat pads,
Yep.
etc., start to fall. Because once, if filler's been put in the right place, and discuss this, if filler's been put in the right place, it's virtually, I mean, nothing's impossible in medicine, but it's virtually impossible for it to travel.
Yeah, it's going to stay where it's put, definitely. But as we age, I mean, we're aging in 3 dimensions. We're aging this way with bone demineralization, muscle loss, and fat loss. And then we're aging in the gravitational pull downward, and we're losing collagen in our skin. So we're going this direction. Studies have shown that we lose approximately 1 millimeter per year at the age of 35 onward. So by the time we hit 55 years old, that's 2 centimeters.
Which is why we're doing skin products,
Exactly.
technology, and filler.
Right.
You've got to put things in there that revolumize, but again, you should never be caught looking like you've had something done. And if it's not done, to wrap this up, if it's not done with a good aesthetic eye, where people have assessed you and have time to assess you, and don't make you look done,
Right.
then what happens is you spend your money, your trust gets betrayed, you spend your money, and then you end up looking, and this is what we have to deal with on a regular basis, to people who they need repair.
Exactly. That tube of filler sitting in the box, that beautiful little box that you're paying for,
A lot of
is
money.
the
Yeah.
same syringe that I'm using, you're using, and everybody else in this country or this world is using to a certain degree. But it doesn't get performed the exact same way in everybody's hands, and that's part of the problem.
And it's the same thing we said about technology. It's about that you can have the best technology, you can have the best filler, you can have the best Botox, whatever we're doing to rejuvenate, to turn back and slow down the clock. But if it isn't done with an aesthetic eye and well performed,
Exactly. Fitting your lifestyle, fitting your personality, fitting your facial shape. These are all important factors that go into this.
So hope this helps. We need to wrap this up. Hope this helps. Education, knowledge is power, and we wish that we could vet a lot of people for you, but sadly we have to see to and
Right.
and unfortunately, my life experience is there's a lot of not necessarily well conducted filler. People try. But there's also some really good people out there. But these facts are things that help you look at yourself and be realistic about what will enhance you,
Right.
but not change you and make you look where people go, oh, look at all of her filler.
Exactly. And I mean, the bottom line is there are people that can afford anybody out there, and you see them on TV, and even them, in some cases, you're like, oh my
no,
goodness.
there's a lot, yeah.
So
And thank you. I hope this helps, and we're going to do some more of these because we're weary of dealing and seeing the things and having people call us who have indeed had their trust betrayed. So again, knowledge is power.
thank
Thank
you.
you.